Hi, Dr. Sasse here from Sasse Surgical, or what is to be Nevada Surgical Associates here in Northern Nevada. And just answering the simple question, how do I know what are the signs that I'm a good candidate for metabolic surgery, or I'm a candidate at all for metabolic surgery? And I would say it really boils down to two lenses through which you look at the question. So the first is, what do we look at as doctors and people who kind of put ourselves in the shoes of you? What would I do if you were my sister or my brother? And so that looks at the medical data. And I would say, to summarize those, we would start with body mass index, and we would say you're a candidate if your body mass index is over 35 and you have any health conditions that are related to excess weight or obesity, especially high blood pressure, type 2 diabetes, sleep apnea, severe degenerative changes like bad problems with arthritis of the hips or knees or spine. And potentially other health conditions like pseudotumor cerebri, which is a really severe form of headaches, or severe liver disease like non-alcoholic fatty liver disease. Possibly other things too, like renal insufficiency. So other medical problems that sort of kick in at that BMI of 35. That's one category. Next would be if your BMI is 40, and just really no questions asked, anybody with a BMI over 40 at this stage, that becomes statistically really difficult to reverse and get down to a healthier weight. So metabolic surgery is the best card to play. It's the safest, it is the lowest risk way of reducing risks and improving health and longevity and quality of life. Through the lens of the insurance companies, it sometimes is a little bit different, but that is the general framework through which they would view it as well. I would just add that the medical data is becoming increasingly compelling that people with an even lower BMI of, let's say, 27 or let's say 30, and with health conditions, especially type 2 diabetes, that there's a really strong demonstrable benefit to metabolic surgery at reducing the risks of stroke, reducing the risks of kidney problems, eye complications, kidney complications, neuropathy, all related to type 2 diabetes. So probably the medical tide, the real evidence has shifted toward a lower BMI qualification with type 2 diabetes especially, but the health plans are very slow to embrace this. So you would be a candidate certainly with a lower BMI of 30 or possibly even 27, especially with health conditions like diabetes. But in the eyes of the insurance plans, you're probably going to be outside of their criteria. In general, the data is really quite favorable, favoring metabolic surgery, especially the sleeve procedure with its very low rate of side effects and complications. And so in general, if you really take an unbiased look at data, even looking at very low BMI individuals, even BMIs of 27 or 30, generally speaking, they do better with metabolic surgery than without it. It's just that it's a little hard for us and most sort of medical practitioners to kind of wrap their head around it. There might even be a preventive element of preventing health problems related to obesity by intervening much earlier. Yes, that's probably smarter. Yes, it's probably safer. Yes, it's probably better for a person's health overall, instead of waiting until serious health problems have crept in. But, you know, as a society and as a medical world, that's often not the way that it's done, and it's certainly not the way the insurance plans cover it. So that framework, just to kind of summarize, take a first look at BMI, which is calculated by height and weight in kilograms per meter squared. So weight over height squared. And a BMI over 35 often is the starting point that gets the conversation going and looking for health problems that would qualify. Certainly anyone with a BMI over 40 is definitely a candidate for metabolic surgery. All right, I hope that's helped, and I wish you the best of health.